We are having the second national training on adolescent health and well-being, bringing together young people from across Cameroon, government stakeholders, development partners to this training. Something was unique about this training because we are launching the dissemination of the toolkit, the health and well-being of adolescents and young people in Cameroon. It is an effort of multi-stakeholder engagement, including government officials, development partners, young people, adolescents, to promote the health and well-being of adolescents. The toolkit compiles policies, compiles actions that promote meaningful youth engagement, and exercises that will empower young people to take up action on the ground to promote the health and well-being of adolescents. It also contains information and insights on how to promote meaningful youth engagement, that meaningful engagement of all stakeholders involved in the issue of adolescent health and well-being. We appreciate the collaboration of all stakeholders who've come on board. Just to say this, training is coming on the heels of the 1.8 million campaign, which culminated in the Global Forum for Adolescents and the Cameroon Forum for Adolescents. 1.8 billion young people for change Cameroon actually helps us to mobilize over 55,000 responses in Cameroon from young people between 10 and 24 years on what they want for their health and well-being. Many of them expressed needs around education, healthcare, peace, development, and we are happy to summarize this before government stakeholders, before other stakeholders, for joint action to promote the health and well-being of adolescents in Cameroon. And we've also presented a strong case of evidence from an economic perspective, a social perspective, on the importance of investing in policies, in actions, service delivery, financing for the health and well-being of adolescents in Cameroon.
Nous avons la deuxième formation nationale sur la santé et le bien-être des adolescents au Cameroun. C'est très unique parce que le lancement de la trousse à outils pour faciliter l'engagement effectif des parties prenantes qui sont les jeunes et les décideurs. Cette trousse contient des politiques, exemples des actions de participation effective des parties prenantes, y compris des jeunes, dans des programmes pour améliorer la situation des adolescents et des jeunes au Cameroun. Nous voyons que quand les décideurs utilisent cette trousse, ça peut faciliter l'engagement effectif des parties prenantes. Et avec le chapitre de la trousse, c'est important de collaborer ensemble pour augmenter le financement, pour augmenter des services et aussi des politiques pour la santé et bien-être des adolescents au Cameroun.
Bonjour à tous, je m'appelle Belle Rina et j'ai participé au programme Disserve. Dans ce programme, on nous a détaillé de nombreuses trousses à outils qui vont aider les jeunes à pouvoir facilement faire des plaidoyers, pouvoir se battre pour leur santé et leur bien-être mental. Bon, dans cette trousse à outils, nous avons déjà appris les différentes lois politiques qui accompagnent les jeunes pour leur bien-être et leur santé mentale, qui sont nationales et internationales. Donc, pour permettre aux jeunes de pouvoir facilement défendre un plaidoyer, il faut déjà qu'ils connaissent ces lois que nous avons appris ici. Aussi, l'orientation conseil. Les jeunes devraient plus se rapprocher des conseillers d'orientation et même des adultes pour pouvoir facilement, avoir une meilleure approche professionnelle, pour avoir un meilleur bien-être professionnel futur dans leur vie. Et également, les jeunes devraient pouvoir se rassembler en petits groupes, pouvoir facilement résoudre les problèmes de leur petite localité. Et pour cela, ils devraient, comme toujours, se rapprocher des adultes et bien sûr se rapprocher d'un conseiller d'orientation et peut-être même les dirigeants des organisations. Alors moi, ce que j'ai retenu dans ce programme, c'est que vraiment, nous aurons toujours la possibilité de changer les choses. Si nous voulons réellement conduire un plaidoyer, non seulement nous devons être éduqués sur la question du litige, mais en plus, nous devons être sûrs de pouvoir nous battre jusqu'au bout pour notre problème réellement. Donc, merci à tous pour cette belle écoute et voilà.
Hello, everyone. My name is Yusuf and I'm a member of DISEF, specifically the IT officer. So presently, we've been doing a lot of work concerning the toolkit about the well-being for adolescents, and my experience in participating as one of the people who would work towards disseminating this toolkit was that in the process of working with people, inviting the people to come and all of that, it was quite tedious. But what is more pleasant about it is that it was adding to that was very fulfilling, and you could see the smile on the faces of people when they get to discover about some few things about their their well-being, and the various solutions that have been brought for them, through this toolkit for their well-being. Yes. So presently, actually, what actually I look forward to, doing after this event, after this training, is that we hope to get as many more people who will go out there and disseminate this toolkit and come back, with the solutions to the toolkit, and how we can even help them, to grow further and to do bigger things with this toolkit. Why not?
Thank you very much. I am Kemcha Martin Tiku, founder and national coordinator of Ruboga organization. I want to say thank you very much to DISEF for this wonderful workshop that we had today on adolescent health and well-being. And I must confess that it was so interesting because the caliber of youth from different organizations that they brought here today and the networking was so enriching. And one particular thing I learned was about the effective roadmap for a good advocacy. That's an additional stuff that is going to help a lot of you that were here today, including myself. And as for the toolkit that the DISEF has prepared, you see, with the statistics they have here, after having interviewed 55,000 people, they came out with a tool, so magnificent tool that I think if we should sit and read it effectively, it's going to go a long way to help our organizations, and we shall spread the word to the youth in the community so that together we fight and have a good health for adolescents in Cameroon. Thank you very much.
ACAP the country director of Open Dream. I am very happy with this finished product. Work of research that has taken so much time together, a lot of in-depth analysis, a lot of realities, exposed that can help our youth to blossom. And I see it really going very far. The right policy actions are taken if everybody is engaged.
I am Madame Champagne from the Ministry of Youth Affairs and Civic Education. Service for leaders of youth organization, Department of Community Life and Youth Participation. Actually, the ministry is really pleased and they want to applaud the effort of DISEF for this group initiative. The health and well-being of Cameroon has always been a priority of DISEF. To sensitize your peers and for this great initiative, it's really something to take back home to the ministry. So we were really honored to be invited to be part of it. And sincerely, I've learned a lot, especially about the Open Dream. The initiative was quite laudable, and as I write close to the ministry, the ministry is there for you. While you guys are ambassadors in the fields, you are a mouthpiece to your peers, the ministry is there. Take the time. So also, and I'm so proud of this initiative. The end result is toolkits which is going to make a lot of impact to the rest. Thank you so much, President. All what I wish to people is to continue with this engagement. Thank you so much.
I'm called Titi Masusu. I'm a community officer in charge of mental health at Deserve. I'm equally a mental advocate. It has been an amazing day today here at the Toolkit of Polytech. This work, which has been finally materialized as this, has been ongoing since 2017. We have had several meetings, several interesting engagement meetings with officials, with the Ministry of Secondary Education, Ministry of Youth and Civic Education, who faced this fantastic work. So I'm particularly very excited because being a mental professional, this work is comprehensive, meaning that it contains elements with respect to youth mental health. And this is really important because youth mental health is becoming a public health issue in Cameroon, and young people need to know about it. So this book can enable every young person to know how to advocate for their physical health and their mental health. It's something which is going to change the way a young person sees their health, because when you are engaged in trying to advocate for something which is of social cause, it also contributes in improving yourself. And I'm encouraging every young person to have a copy, to request their school to have a copy, be it digital or hard copy, because it's going to go a long way to improve the health standards of young people in general, and young people in communities, in schools, everywhere. Advocating for change is an important thing to be done, because if young people themselves are not involved meaningfully into their health or into the things which relate to their health and their well-being, it might be very difficult for things to move to the point where it has to move. That is where young people in Cameroon, everyone in Cameroon, to receive or have the healthcare services which are suited to them. Because every young person deserves the healthcare services, the mental care services which they need. And this book, if it's used, is going to contribute into that. So I'm very happy that finally this book is out.